Part A. Extract 1. Questions 1 to 12. You hear a physiotherapist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I'm Hayden Park, your physiotherapist today. Let's start with what brings you in.
Hi. So, it's been a bit of a saga, honestly. I've had this recurring ache, sort of deep set, in my left shoulder and upper back. It's not sharp exactly, but it gets worse after I've been sitting for long periods, like working at my laptop. At first, I thought it was just poor posture or tension, but it's been going on for about 4 months now and actually seems to be spreading down toward my scapula and sometimes even into the triceps area. Some days it even feels like a low-level burning sensation.
Okay, sounds persistent. Can you describe exactly when it flares up?
Yeah, so it's worst after a long workday. I'm a graphic designer, so I'm basically glued to my chair for 8 to 10 hours a day. I've tried to make my workstation ergonomic, got a standing desk, repositioned my monitor, all of that, but the discomfort persists. It can even wake me up at night. Occasionally, there's some numbness radiating into my fingers, mainly the ring and pinky ones, which kind of freaked me out.
That's useful detail. Have you noticed any associated headaches or neck stiffness?
Oh, definitely. I get these tension headaches, like a tight band around my forehead, and sometimes I can barely turn my head to the left when I wake up. I also clench my jaw a lot. I think it's stress-related, but I'm not sure if it's all connected.
Sounds like we're dealing with multiple contributing factors. Mihiraa, have you tried any remedies so far?
Too many to count. I've done YouTube stretching routines, used a foam roller, bought one of those neck massagers with infrared heat, worked temporarily, but nothing lasting. I saw a chiropractor a few times too. They said I had mild cervical misalignment, but I didn't feel any long-term change. I even tried acupuncture, but it made me more anxious than relaxed. I did take ibuprofen occasionally, but I don't want to rely on medication.
Understood. Mihiraa, based on what you've described and what I'm observing, it's likely you're experiencing myofascial pain syndrome, essentially chronic muscle tightness and trigger point sensitivity, particularly in the levator scapulae and trapezius regions. Your symptoms also suggest some postural dysfunction and nerve impingement, probably due to prolonged static positioning.
So, not a disc issue or anything serious.
No signs of disc herniation from what you've said, but we'll rule things out as we go. For now, we'll focus on soft tissue release, postural retraining, and strengthening exercises.
Okay, and what does that involve exactly?
First, we'll start with manual therapy, including myofascial release and deep tissue massage, targeting the cervicothoracic junction. Then I'll show you a series of isometric scapular stabilization exercises and thoracic extension drills to counteract your forward posture. We'll also introduce neuromuscular re-education to restore optimal movement patterns.
Sounds intense.
It's progressive, Mihiraa. Initially, we'll keep the sessions gentle and build up tolerance. You'll also get a home exercise program focusing on pectoral muscle stretching, rhomboid activation, and eventually core engagement for postural support. I'll also assess your workstation setup more closely and suggest micro-break strategies.
Will I need to come in weekly?
Let's start with twice a week for the first 2 weeks and reassess. If things improve, we'll reduce frequency. Long-term, the goal is self-management and symptom prevention.
All right. Thanks, Hayden.
Extract 2. Questions 13 to 24. You hear a gastroenterologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa.
Good morning, Dr. Tori. Well, for the past few days, I've noticed a strange yellowing in my skin and the whites of my eyes. It's mostly noticeable around my palms and forehead. Have you any idea what it could be?
Yes, Mihiraa. Mostly this happens when a substance called bilirubin builds up in your bloodstream. Normally, your liver filters it out of your blood and excretes it in your stool. But if it is too much or your liver isn't working properly, it can cause this effect.
Oh, that sounds concerning.
Absolutely. We can do a simple blood test to measure its levels. But before we jump to conclusions, let's get some more information. Can you tell me if you've recently had any travel, changes in your appetite or bowel habits, or any unusual fatigue?
Actually, now that you mention it, I did travel to Southeast Asia a few weeks ago. And come to think of it, I have been feeling a bit more tired lately.
Interesting. Are you currently taking any medications, over-the-counter supplements, or any herbal remedies?
No, not really. I take an occasional aspirin for headaches, but that's about it.
Great. Do you drink any alcohol regularly, or use any recreational drugs?
No, I don't drink much alcohol at all, and definitely no drugs.
Okay. And how would you describe your typical diet?
Well, I wouldn't say I'm a health nut, but I try to cook most meals at home. I do enjoy a burger or fries occasionally, but not all the time.
All right, that's helpful. The blood test will be a good first step. In the meantime, staying hydrated is important. You can also try over-the-counter medication or sodioxycholic acid to help with the itching that occurs sometimes.
That's a mouthful. But if it helps with the itching, I'm willing to try it. Itching sounds awful. Is there a test to confirm the condition?
Absolutely. We can do a simple blood test to measure your bilirubin levels. Once we have the results, we can discuss the next steps in treatment. Treatment will depend on what's causing the condition.
Okay, that makes sense. What are some possible treatment options?
Well, that depends. If the condition is caused by a viral infection like hepatitis, medication might not be necessary. Your body will usually fight off the virus on its own, and the condition will clear up along with it. However, if the cause is a blocked bile duct due to gallstones, we might need to remove the gallstones. This can be done with medication, laparoscopic surgery, or even a traditional open surgery, depending on the severity.
Surgery? That sounds serious. Is there anything I can do to prevent that from happening again?
Absolutely, Mihiraa. Making some lifestyle changes can help reduce your risk of gallstones. Maintaining a healthy weight, eating a balanced diet low in processed foods and saturated fats, and increasing your fiber intake can all be beneficial.
A balanced diet and more fiber sounds manageable. How long does recovery from this typically take?
As I said earlier, the recuperation period depends on the underlying cause. The blood test will give us a clearer picture of the timeline.
All right. That gives me a better idea. Thank you for explaining everything so thoroughly, Dr. Tori.
You're welcome, Mihiraa. Let's get you scheduled for that blood test today. We can discuss specific dietary recommendations after we get the test results.
That is the end of Part A.